Hello all, I am Dr. Manas Ranjan Tripathy, Senior Consultant Laparoscopic and General Surgeon from Bangalore. I welcome you all again to my video awareness channel. In continuation of our discussion about pilonidal sinus, today I will be updating you about the various treatment aspects which are available to cure this condition called pilonidal sinus disease. Like we have discussed before, various patients have various degrees of symptoms with pilonidal sinus disease. Many of them are asymptomatic, but while diagnosing, while clinical examination, they are found to have pilonidal sinuses. Basically, for asymptomatic patients, we follow a wait and watch policy. That is, if they develop infection, if they develop persistent discharge, then we go ahead and treat them proactively. Usually there is no need for treatment because many of the patients, they remain asymptomatic lifelong. Then are the category of patients who come with acute symptoms with severe pain, boggy swelling and abscesses. These are the patients who need to be attended immediately on an emergent basis. If the abscess or infective area is very small, we initiate them with conservative measures like good antibiotics, good anti-inflammatory and local hygienic care like warm compresses and all. If there is a very small pus collection, it usually settles with this and the inflammation gradually settles. And based on whether they have the symptoms again or they have recurrent symptoms, we decide the future course of action. But in some patients, the inflammatory presentation like acute onset of symptoms is very severe, like they have a big abscess with involving a wider area, severe pain and symptoms. So in these patients, we have to undergo immediate incision and drainage of the pus. We have to relieve the pus away from the sinus openings. So we take them either under a local anesthesia or under a general anesthesia in the operation theatre. We do a small procedure called as incision and drainage of the abscess and debride the entire sinus cavity, remove all the tufts of hair material and stuff, so that it gives a good chance of healing from the sinus abscess. So this is a emergent procedure which gives immediate relief to the patients, and they recover in a day or two's time. Again, after this procedure, if they have recurrent symptoms, recurrent abscesses, or chronic pus discharge, then we need to do a definitive treatment for the sinus complex. The other variety of patients which are the more commoner type, that is the patients who have intermittent low intensity pain but chronic pus discharge, foul smelling discharge from the intergluteal cleft region, they need to be properly planned, and based on the type and presentation of the disease, the extent of the sinus openings, whether they have satellite openings in the gluteal region or not, then the final treatment for the pilonidal complex is planned. If it is a very small midline sinus which is happening again and again, simple excision of the sinus along with the margin of soft tissue and allowing the sinus for secondary healing is a treatment which is time tested, which is always more than effective, but with a demerit of longer recovery and wound healing. Because the wound has to heal of its own with secondary intention, they will need repeated dressings and taking care. But the advantage of this procedure is that recurrence rates are minimal. Another approach to treat is to excise the primary sinus along with a wide margin of the skin and do a primary closure of the opening, which is done surgically. So advantage with this method is that the dressings, the requirement of dressings and the follow-ups are little less, and wound healing is faster with faster return to work and other activities. But the glitch is in the patients who have multiple openings in either buttocks. These complex diseases need proper planning and tissue reconstruction methods for preventing recurrences. If there is a wider area of involvement, then we usually prefer multiple flap techniques, starting from local advancement flaps to rotation flaps and all, to obliterate the midline gap which is formed after removal of the wide sinus complex. So we don't need to go into details of this, but basically, if there is a complex disease which is again and again recurring in a patient, even after prior surgeries or prior simple procedures, usually patients need flap reconstruction for preventing recurrences. But the recent times has seen the advent of endoscopy and laser, which has revolutionized the treatment of pilonidal sinus. If you ask me, in the last 5-6 years, we have had tremendous results with using laser ablation for pilonidal sinuses. It's a simple OPD procedure wherein the sinus tracts are dilated, all the necrotic material, hair tufts are just drained from the openings, and all the debris are evacuated from the openings which are already present in the disease, and then the entire sinus tract is ablated with the laser. This leaves the patient with no wounds to take care post-operatively. Patient is back on to work in 2 to 3 days time. Beautiful results, and absolutely no post-operative wound care is needed with laser. So this laser advent of ablation of pilonidal sinus has really revolutionized the treatment, and we have had excellent results with patients who were spending at least 6 to 8 weeks for healing for pilonidal sinuses. Also is endoscopic excision of the sinus tracts, wherein we, with a small camera, we go into the sinus tract, remove all the debris, and either curatize the sinus tract or ablate it with again energy. So this also has beautiful results, and these are the two main promising advents in the treatment of chronic pilonidal sinuses, which has made life easier for both the surgeons and the patients in modern days. So depending on the type of the sinus, the type of the symptoms and the recurrence rates, we usually choose a procedure which is best suited for that individual at that point of time. So anybody of you who have a sinus disease, please go and consult with your surgeon, who will examine you and then decide the appropriate course of action. It is a potentially troublesome disease to have. It's not life-threatening, but keeps troubling you, affects your quality of life again and again. So if you have symptoms, please seek attention of your surgeons and get yourself treated. Thank you all for patient listening. We'll be back with you with another awareness video on some topic. Thank you.